coverage you can count on begins with rankings in Georgia. The Peach State is in the top 10 when it comes to population, but the bottom 10 in some healthcare categories. So how do we fix it? Federal money could help. Here's News Channel 6's Ashley Osborne.
A nearly $400,000 grant from the USDA given to the Medical College of Georgia paid for this telemedicine equipment here in the emergency room in Augusta. It also paid for 5 telemedicine carts in 5 different rural Georgia hospitals. Here's how it's helping doctors, patients, and the taxpayers in general. Of Georgia's 159 counties, 58 of them have no emergency medicine doctor. Now, with one click,
let's try manual.
Doctors at MCG can virtually be in the ER in Emmanuel County, Georgia.
If they had a trauma patient come in, they could call us immediately. Hey there!
Dr. Matt Lyon breaks down some of the devices they can use from miles away.
Ultrasound, airway devices, any basic emergency procedure.
A $369,000 grant from the U.S. Department of Agriculture paid for the telemedicine carts to go to Swainsboro, Washington, Sandersville, Colquitt, and Cordele.
Telemedicine has traditionally been very expensive because it uses proprietary equipment. This system is based on traditional teleconferencing software.
Telemedicine is also typically used for specific conditions. This program uses the technology in the ER, which could save the patient hundreds, maybe thousands on an ambulance ride. Dr. Richard Swartz says the method is also better for the rural hospitals.
The finances of healthcare is very, very difficult for the rural hospitals in this day and age. And one of the intents of our program is really to keep every appropriate patient in their own hospitals if possible, and to get patients back into those hospitals after the acute care setting.
Because when a patient stays in a rural hospital, so does the money many of them desperately need, and more money coming into a rural hospital means less burden on the taxpayer.
The initial 5 hospitals is just the tip of the iceberg, because we see this as a rapidly expanding program throughout the state to improve the health care.
In Augusta, Ashley Osborne, WJBF News Channel 6.
This program could mean more now than even just a week ago. On Tuesday, lawmakers started looking at state budget cuts, and those cuts could affect rural health care.